Good evening. It's scary to witness anyone have a seizure, but what happens when that person is your own child? What causes seizures? What do the signs and symptoms look like? How can EMS help? We go live now to Dana Pesavento, mother of baby Graham, who recently had a seizure.
It was just a normal day at home, and Graham and I were sitting on the floor. He had just gotten done having a snack, and next thing I knew, he just stopped breathing. And we were sitting on the floor, so he was laying on the floor. Next thing I knew, he started shaking. I was so scared. I had no idea what was going on. I didn't know what to do. I sat there and I kept calling his name, and I said, "Graham, Graham, Graham," and he wouldn't wake up. I didn't know what to do. I was so scared, so I called 911.
We go now live to Dr. Sutherland, the medical director at CDH. Hi, Dr. Sutherland, can you tell us what different types of seizures are there?
There are three basic kinds that occur very commonly in children. There are absent seizures, there's partial seizures, and then there's grand mal seizures.
And what goes on inside the body that causes a seizure?
Pretty much pediatric and adult causes of seizures are fairly much identical. What leads you to have a seizure is something that within the brain actually increases the threshold for you to have a seizure, and that would be some electrical activity is increased, and once that starts, then you lose your connections in the brain and the seizure takes over. The other cause is a lowering of the seizure potential, and that's usually due to drugs or metabolic causes.
What exactly is a seizure threshold?
We all have kind of an electrical activity of the brain that is functional, meaning all the connections are there, we're able to process information, go about our daily lives. If you get a spike in the electrical activity, it could exceed the seizure kind of governor, if you will, within the brain, and it leads to a seizure. There's also conditions that lower the threshold, in other words, lower the governor that's kind of monitoring this or preventing seizures, and then you also can have seizures. So it's a function of what's either you're increasing electrical activity or decreasing the threshold or the governor that kind of monitors or prevents seizures.
Okay, and what are some common causes of seizures?
Drugs or medications can lead to seizures. Typically, they do that by lowering the seizure threshold that we talked about. Strokes, bleeding in the brain, whether it's spontaneous, like a subarachnoid hemorrhage or intracerebral bleed, or from traumatic causes, subdurals, epidurals, as you know all about. Metabolic causes, these are where there's a change, usually in glucose, either too high or too low. Typically it's low. In lowered calcium, lowered magnesium, sodium changes, whether it's high or low, can lead to seizures. So somebody who's severely dehydrated is at risk, or somebody who's drinking lots of water and washes out all the sodium, they are at risk. And then in children, there's this category of causes called inborn errors of metabolism. They are genetically prone to have seizures, not due to epilepsy, but because their body is not making certain chemicals in the body, which can put them at risk for seizures. And then the last thing is cancer, whether it's a primary brain tumor or metastasis to the brain. These mass lesions at some point put enough pressure, increase the spikes, the electrical activity, and then they can have a seizure from that.
And what's most common for peds specifically?
Seizures. Well, in children, febrile seizures are by far the most common. But then you have to think for those children that infections are the cause. This could be from viral, bacterial, or even parasites. Parasitic infections are rare in kids, but if they're from Central South America, then they are at risk, and we have to evaluate them for potential parasitic infections.
And can you demonstrate a seizure for us so we know what it looks like? Great, thank you so much for your time. Absent seizures. Signs and symptoms include confusion and loss of awareness, staring into space, and drooling, especially in young kids. Partial complex seizures. Signs and symptoms include localized muscle spasms, lip smacking, and others not shown, clapping and chewing. Generalized seizures. Rhythmic jerking of the entire body. Your breathing ceases, incontinence, and a postictal period. When EMS is called to the scene for a pediatric seizure patient, they will do the following. They will protect the patient without restraining the patient. They will open and maintain the airway. They will never place anything in the patient's mouth. They will then roll the patient on the side unless it's contraindicated. If a pediatric patient is actively seizing upon arrival, EMS will administer a medication known as midazolam, or Versed. They will administer 0.1 milligram per kilogram IV or 0.2 milligrams per kilogram IN diluted to a total of 2 milliliters for a max of 10.
I just came into work and I had to talk to Dr. Graham, and I just remember a bright light and that weird smell again. It was that feeling of deja vu, and how did I get here? Why are my pants down? I woke up and my pants were around my ankles. What is this stuff? Oh my goodness.
When in doubt, pull it out.
This patient has not been assaulted. When consulting the experts, we learned that an effective yet less favorable method of controlling seizures is rectal Valium. Rectal Valium is given to patients who have seizure disorders. EMS will administer rectal Valium if the patient has been seizing for over 3 minutes or if the patient has been seizing repeatedly without regaining consciousness in between. A diagram is below for administration. That concludes our report on pediatric seizures. This is CDH, and we will see you again. That concludes our program. Thank you for joining us. This has been a CDH production.